Good morning, everybody, and welcome to the OPT Network. This morning, we're talking about a subject that so many parents are confused about and really need more information, and that is ADHD. It's often referred to as ADHD, but really it stands for Attention Deficit Hyperactivity Disorder. Here to talk about this very important conversation is America's favorite psychologist. She's been practicing for nearly a decade. She is consulting for media outlets. She's has her own television show, and she's doing a lot of work in the field. She's also the author of Practical Guide to Raising Emotionally Healthy Children. This morning, Dr. Nekeshia Hammond joins us again on the OPT Network to talk about ADHD. Her new book, Explained, What Every Parent Needs to Know. Dr. Hammond, good morning and welcome.
Thank you. Thank you so much for having me.
It's an important conversation, and here's what the American Psychiatric Association says, or the APA. They say about 5% of American children have ADHD, but the CDC reports that it's more like 11% of America's children. First of all, let's talk about why there's such a big discrepancy and why is ADHD so misdiagnosed?
Yeah, so what's interesting about that is the data, it's a little confusing, I think, because a couple years ago, the statistical manual that basically diagnoses ADHD, the criteria changed drastically. So what happened was we're now able to diagnose children when they have those symptoms before the age of 12, but it used to be you could only diagnose when the children had those symptoms before the age of 7, which that in and of itself means we're diagnosing a lot more children. And it's not that they didn't have the condition earlier, it's just they changed the criteria for it. So sometimes what happens is there's such a huge difference, like you mentioned, with how many children actually have ADHD.
Okay.
But my thoughts, go ahead.
No, go ahead.
Oh, no, I was just saying, well, my thoughts as far as you had asked about why it's misdiagnosed, and I really strongly believe because it's the go-to diagnosis. Oftentimes, children are diagnosed with ADHD after a 5 or 10 minute visit to the doctor, instead of taking the time and doing a comprehensive evaluation and looking at many other factors that could be in play for attention problems.
Like what, for instance?
Like, I've seen so many children that actually did not have ADHD, but instead they had anxiety, or they were literally just struggling with something that was happening in their family, or they were traumatized, or a lot of times I see children that actually have problems. They have a learning disability, but it looks like ADHD because you can't function. You're having trouble learning, but it's not ADHD, or depression, or the list goes on and on. So there's a lot of other things that look like ADHD, but instead of taking the time to look at a child in whole, we tend to just, he's hyperactive and he can't concentrate, he has ADHD, which is not always the case.
Right, and I think that's why this book is so important, and this conversation is even more important than that. Now, you have written the book in a very simplistic form. It doesn't have a lot of scientific jargon so that people can really understand what they need to know and understand what to look for in their child. Let's talk a little bit about that.
Yeah, and you're absolutely right, because of course there's, some references in the book, but I wanted to make the book very practical because I have never ever had, out of hundreds of kids that I've seen in families, I've never had a parent come in and say, please sit down with me for an hour and tell me all of the research studies about ADHD. Nobody does that. They say, how do I help my child? So I wanted to make the book really practical and say, here is step by step. Here's how to get a proper evaluation. I spent 3 chapters on that, of how to get a proper evaluation. And then what do you do at home to help your child? How can you advocate for your child in the school system? How do you help yourself as a parent? Because it's difficult. But all of these things that parents have asked me for so many years, I put into this book to have as a tool, as a resource in their toolbox. So I'm thrilled and I'm excited to release this.
And so the reason why it's so important is because there are so many parents that are grappling with that diagnosis that they got that you talked about earlier, 5 minutes, and yes, your child has ADHD, and here's the medicine that we're going to use. I can't tell you the countless parents that I have spoken with that are struggling with putting their kids on medicine. Let's talk about what that conversation should look like and sound like when you're talking to your pediatrician.
Yeah, and I will say I am a psychologist, so I do not prescribe medication, nor in the state of Florida anyhow am I permitted to prescribe medication. So I do want to say that, so I am a little biased. I am not anti-medication by any means. However, the entire book is written about all of the strategies that you can do without resorting to medication, because I've seen so many children that did not need to be medicated. It was a milder form of ADHD, and they learned through therapy and through interventions in the school and things to change around at home. They learned how to function, and that's the number one goal. So sometimes, yes, in more severe cases, you do need medication, because no matter how much therapy you do, it's physiologically it's very difficult for some children to function. But the biggest thing to look at is, what is the functioning level? I mean, is the child happy? How are they doing in school? How are they doing at home, in the community? These are things that we need to be thinking about, instead of just jumping automatically to medication. I had a dad in my office the other day who was like distressed because he's like, he waited for 2 hours for the pediatrician, which was a long wait, with a young child. He went in, the child was bouncing all over the place, as any young child would after waiting 2 hours. And the pediatrician, after 5 minutes, said, well, here's a script. I know exactly what he has. It's ADHD. Start medication, which is so inappropriate. We have to change that system.
Right. And so how do you, as a parent, challenge your doctor or ask the questions based on you knowing your child, but then you on the other side of the coin, you have a teacher that says your kid is disruptive. I'm not able to conduct classroom lessons because they are bouncing off the wall.
Mm-hmm. So the first step, and I will say, I don't want to badmouth all pediatricians here, because I work with a lot of pediatricians that are very psychologically and mental health savvy, and I absolutely adore them. But tell your pediatrician, some pediatricians don't know, I want a psychological evaluation, and they can refer you to specially trained child psychologists. It needs to be a specialist in that area who can do the evaluation for you. Again, it takes hours to do this evaluation. There's a lot of steps, which I outline in the book, but there's a lot of steps to really make sure of what you're dealing with. And one of the things that I've always been saddened about is I don't think that we make, in our country anyhow, I don't think we make children a priority. So just as how with an adult, we wouldn't, when you go to do blood work, you see, is there, what's going on at the blood cells or thyroid or blood sugar. We look at all these things, but with kids, we take 5 minutes and we say ADHD. And really, a psychological evaluation is like blood work. It's to see, is there depression, anxiety, behavior? How are they doing socially, emotionally? You look at all these different factors and then decide how to treat the child best.
Wow. So maybe we shouldn't turn to the pediatrician first to make this diagnosis. Maybe we should be turning to a psychologist as opposed to a medical doctor. Is that safe to say?
I think we should do both. I do think the pediatrician has a place, and that's actually one of my earlier chapters in the book, is to go to the pediatrician, because you do need to get blood work done first. I tell every single parent that walks in my office, let's make sure, because attention issues can be related to a physical health condition. A child could have difficulties regulating their blood sugar, and their moods are all over the place. They could have difficulties with their thyroid. They could have anemia, low iron. There's all sorts of vitamin deficiencies and things like that can look like that. So I definitely recommend to go there, but get the blood work done, right, to make sure there's nothing physical. Then the next step is to go to a mental health professional, who we specialize in this area of ADHD, to really make sure there's not other things going on. And even the CDC recently, they said that almost 2/3 of children with ADHD have another condition.
Wow.
And what I'm seeing constantly, consistently, is that is not being addressed, and that is very problematic. And the pediatrician's office, when you just say ADHD, that's it. No, there's a high chance that there's something else too.
Our guest this morning is America's favorite psychologist, Dr. Nekeshia Hammond. We're talking about ADHD. We're going to take a break here, but when we come back, we're going to talk about what if your child has been diagnosed. How do you reverse the situation and help your child to get better and more effective? Stay on point. We're back right after this. Welcome back, everybody, to the OPT Network. Our guest this morning is America's favorite psychologist, Dr. Nekeshia Hammond. Nobody's doing more to really affect and impact families, the way that we deal with our kids, and most importantly, helping us to understand what they need to be productive students and people in the world. Her book is called ADHD Explained, What Every Parent Needs to Know. Now, before we went to break, Dr. Hammond, we were talking about the logistics and understanding why. Now, there are a lot of parents that are watching right now and guardians who have placed their children on medication. Let's talk about the medication, what it is, what it does, and how it affects the mind.
Right. And so there's different types of medications. There's stimulants and non-stimulants. So if we think of a stimulant like coffee and things like that, for the average person, whether or not you have ADHD, a stimulant will help you. That's why people drink coffee. It helps you concentrate better. So again, and just depending on different medications, sometimes there's side effects, sometimes there's not. Just as how when we take something over the counter, some of our bodies react and some of them do not. But really the most important issue with the medication piece is to make sure that it is being monitored by a physician. That's very important to go to the follow-up visits. And really, I mean, some people have decided to move away from medication. The most important thing is medication in and of itself is not going to solve certain problems that come along with ADHD. There's some children, they have a hard time with their self-esteem. They don't think they're normal. They wonder why they're different and all those sorts of things. Medication is not going to solve that. That's where therapy comes in, to learn the skills to cope with the condition, to understand things that the child can do themselves to get through, to help the family, even parents all the time, like, how do I cope with this, right? Or they may be very different from the next child in the household. So the therapy piece is important too. And again, sometimes I've seen some kids that have discontinued medication in their, let's say, their teen years, and they're fine, and they've learned the skills to cope with this. And again, some teens not, but there are some teens that do.
Mm-hmm. Now let's talk about the therapy piece, because a lot of parents, a lot of families never really think about that piece and how important it is, especially if you're dealing with a younger child who's between age 6, 7, and above. We don't really think about therapy.
Yeah. And so, and it's sort of a flawed approach, like to think that, I know a lot of people say, well, what can a 6-year-old do in therapy?
Right.
Well, a 6-year-old would not do traditional therapy like an adult would do it. So it's not sitting on the couch talking about your problems. And that's what most people think of therapy, or that's what's on TV. But really, for a 6-year-old, they would do something called play therapy. So to them, as a 6-year-old, it's fun. It seems like they're playing. Obviously, it's very structured, but it's helping them learn the skills, helping them learn to reduce the hyperactivity, to work on the impulsivity, learning how to take turns, learning how to deal with their triggers for being unfocused. But again, done in a way that it seems like it's playing, or it seems like it's gameplay therapy, but it's something that has been shown to be very effective with kids with ADHD, for the much younger crowd. Mm-hmm. Of course, once you get to the teen years, we're not playing so much. It's a little bit different. But
absolutely. Yeah,
definitely that is a form of therapy. And I did, address that as well. Play therapy is an option for the younger crowd, even, preschool age too. And what the American Academy of Pediatrics has recommended for the younger crowd, the preschool age, or, the 3, 4, 5-year-olds, is to not start with medication and to start with a behavior or a therapy instead of starting with the medication. They have made that recommendation. Now, some people don't follow it, but they have made that recommendation to start with the therapy for the younger crowd.
And so speak to the parents, Dr. Hammond, that say, my child is already on medicine, and the medicine makes them lethargic. They're not nearly as active, which could be a plus for sitting in a classroom and being able to be present. But it changes the dynamic of my child's personality, and I don't like that. What do you say to those parents?
I hear that a lot. I hear my child's a zombie, they don't have the same personality, they're not as creative, all these things. And I always say, you know what, you need to go back to the physician because medication is not supposed to have those types of effects. So again, as a non-medical physician, I recommend they go back to the psychiatrist or the pediatrician or whoever put them on that medication and express those concerns, because a medication, typically it's, the dosage is wrong, or the medication is not the right medication if it has those type of side effects, because we don't want children sleeping through class, right? I mean, obviously. Right. And that happens though with some kids. They're so drowsy. It's like, well, now we're at the other end of the spectrum. So we don't want, so definitely go back to the physician and express your concerns. And, in some cases, sometimes you need a second opinion and you have to, go to another professional, but make sure that your child is not a zombie, that they're not a huge personality shift, and and really looking at those side effects and and weighing out the benefits versus the side effects.
And so for those parents that say, okay, I believe that the medicine has 100% helped my child went from failing everything to now they're successful. I know that you're not a doctor who prescribes, but what do you say to those parents that are concerned, will using a drug like this to focus and to do well, will this be a problem up the road? Are there any studies that show that this will lead to addiction or the need for something?
Yeah, and the studies in that regard, they're very mixed. So, some studies do show that there's some potential for addiction. Many studies do show, that's not the case. It's very mixed out there. But I will say that, it's so important to monitor the medication process. There's many teens that I've met that have been able to reduce the medication or stop the medication all throughout because they learned the skills to get through. And sometimes a lot of times parents will say, is ADHD curable or does it go away? And what I really say, it's not really curable or necessarily going away, but some people don't necessarily have the symptoms as strongly in their teen years or adult years because they've really learned to manage the symptoms. That's why it's so important. I urge families to get help early. It's so much easier to teach a 6, 7, 8-year-old than when you're in your 20s and 30s and 40s. Not that it's impossible, but it's a lot easier when you're younger to learn the skills to deal with this.
Mm-hmm. Do you think that a lot of it, Dr. Hammond, is based on just discipline and learning the skills, the coping skills, as opposed to really being this disorder that so many people have labeled children as being?
Yeah, and a lot of studies do show it's not it's not due to poor parenting. That's actually a myth. That is due to poor parenting or it's due to a lack of discipline, and it's really definitely not the case. I have seen it's heartbreaking sometimes. I've seen some kids that struggle so badly with the hyperactivity and the impulsivity, and no matter what type of parenting, it's not their fault, and they want so badly to behave and to do well, but they physiologically cannot control it. There are some kids that just cannot control it. And then you have some milder cases that with, I wouldn't say discipline, but with the appropriate structure that we can help their symptoms. It's changing the environment, and that happens a lot at school and at home, that we can really help to reduce those symptoms.
Mm-hmm. And so what are you saying to teachers on this subject? Because there are so many teachers that are really diagnosing ADHD before a doctor even comes into play. We're going to take a break, but when we come back, we're going to talk about how to help those people on the front line, because oftentimes it's really not parents. It's our teachers who are making these recommendations. We're going to talk about that, plus some of the myths, and most importantly, how you can connect with Dr. Hammond and get this important book. Stay on point. We're back right after this. Welcome back, everybody, to the OPT Network. Dr. Nekeshia Hammond is our guest this morning, and we're talking about ADHD, or Attention Deficit Hyperactivity Disorder. The book is called ADHD Explained, What Every Parent Needs to Know. And Dr. Hammond, I think you should have put what every teacher needs to know as well, because oftentimes it's the teacher that presents to the parent this whole idea that your kid can't behave and they need some medicine. What are you saying to teachers about this subject? Yes, very true. And actually, that is, well, I guess we'll break the news. No, that's a new book coming out, actually. That's the next book. Yes, it is. Okay, good. So you heard it first now. But yeah, for the teachers, that is so true. We have so many referrals from parents because the teacher said, literally a parent would come in and say, well, the teacher said my child has ADHD. And I'm like, what? So really the best advice I can give to teachers is, well, a couple things. One, please do not tell parents that their child has ADHD. Please do not say, well, I have a child with ADHD at home, so your child has ADHD too. Please don't say that, because some of the time it is accurate, but some of the time, and a lot of time it's not. So please instead maybe recommend, or even to the guidance counselor or the counselor in the school, for them to talk to that person, and then they can get them to the appropriate resource in the evaluation. The second piece of advice that I would give, usually, well, in our office after we do the evaluation, we give handouts or information and things like that for the parents to discuss or give to the teacher. When you get that information, please be cognizant that not every child with ADHD looks the same. It can actually, the disorder can manifest in many different ways. And I love that. I will say I love that I've had a lot of teachers that have had meetings with parents that have been very open to the idea of, please tell me about your child. So please be open. And I know there's so many stereotypes about ADHD out there, but please be open to that particular child and the unique qualities that they have. Especially in girls, we see that there's not necessarily the hyperactivity piece. That's another myth, that every child is hyperactive. But there's a we call it predominantly inattentive presentation, where there is no hyperactivity, but you still do have ADHD. So a lot of times those kids are missed because there's no behavior problems, or because maybe they're daydreaming and they're kind of off, but they look like they're paying attention when they're really not. So keep in mind, some teachers are shocked and they're like, there's no way the child has ADHD. It's like, you know what I mean? Like, they're missing, key instructions. So be open, I would say, as a teacher, and do your own research too. Good, credible sources, of course. But do your own research to really understand this, and let's try to reduce the stigma of mental health and try to reduce the stereotypes that we have about ADHD. And the diagnoses and the symptoms, if you will, are so varying and widespread that there's not just one, that you could say to people who are listening and watching, okay, if your child has this, this, and this, then it's a good chance. So how do you break down the vastness of ADHD to get to, is this what my child has or not? Right. And that really comes from, from a clinical perspective, if you will, and an evaluation, it comes from looking at the whole child and looking at all these other things. And when you can start to say, well, it's definitely not a learning disability, it's definitely not a behavioral, it's definitely not depression, you start ruling out all of these things, but your data is just popping up like ADHD is, very elevated. But we've already determined all these other factors are not in place. Then you really start to know that it's ADHD. But you can only know that, like you said, if you, take the extra step and get an evaluation, because I can read you the criteria right now, and it looks different among so many different children. You're not attentive, you're hyperactive, or you're daydreaming. A lot of kids do that, right? But to take it to that step and to see in depth from a mental health professional what is really going on with a child makes a world of difference. And let's talk about the daydreamer, because a lot of kids get in that box where at a certain age, they're just not present. They're in their own heads, in their own worlds. And I don't know that there's a whole lot that you can do about a kid that's daydreaming. Right. And and like you said, kids daydream, especially the elementary schoolers, they daydream, they think up all sorts of things. They're thinking about their video games or superheroes or whatever they're thinking about. But the differences with ADHD is when it really starts to affect functioning. So you're looking at a child that used to be A and B student. Now the grades are slipping. Now the teachers, constantly, calling on them, like, come back, or
they're asking a question that has nothing to do with what the teacher's talking about, and those sorts of things. Like, they're really, really off task. When it gets to that level, that's when, as mental health professionals, that's when we really get concerned. But of course, like you mentioned, and that's one of the problems, is there are quote unquote normal children, right? Every child daydreams. We daydream as adults.
Yeah.
But it's when it gets to that point where it's really interfering with their functioning is a problem.
And so the most important thing, I think, and take away from the book, Dr. Hammond, is what?
The most important thing is, the very most important thing, if you don't know if your child has ADHD, is how to get an evaluation, what it looks like, what to expect at those visits, and to make sure to get the help early and don't wait. On average, people wait years before, all sorts of stigma, all sorts of things. Ignore what everyone else says around you and just concentrate on making sure that your child is okay. Because
all right, let me stop you right there, though. Okay, let's talk to that person who's got a 6-year-old. They're in the first or second grade, and they feel like it's really too early. And you're saying don't wait. So how does a parent know that they need to, say, reach out to a Journey Rehab, which is in our area, that is a mental health facility that helps with things like that? When do they know?
I would say, I would say give it a few months, because sometimes I work with a lot of kindergartners for some reason too. And kindergarten is a hard year, right? So let's say they're 6, they're older, and they're entering into kindergarten. It's a transition year in and of itself. So I'm not saying after 2-3 weeks to do something. Sure. But when you see after the first couple months, and now, you're getting to the January of the school year and things like that, and things are not working, and you're trying things at home, and you're trying things in school, and things are not progressing, and it's getting worse, then don't wait until it's like, now we're repeating the school grade. Now we're doing all these other things that we didn't need to do. So I think if parents can get in the mindset, and I know it's hard, but get in the mindset of prevention instead of intervention, we can do amazing things for children. So really, again, after I would say a couple months or so, things are worsening, get some help.
Absolutely. And I think that's why this book, Dr. Hammond, is so important. It's simple. Anybody can read it and understand point blank what you're saying, what you're putting out there, and making that connection with parents and teachers to see if an intervention needs to happen as opposed to medicine very early, I think will help a lot of the failure rate, and it'll help teachers, parents, and students.
Absolutely. Yes, definitely. It's so beautiful for everyone, really, because it will help teachers. Because if you do the prevention side, if you think of it, start early, you're literally preventing a lot of the issues, behavioral issues that sometimes do come about later on. Grade slipping. Some kids are repeating grades, and it's so sad, because when I test them, I'm like, this is a really bright child. If we had put the things in place, you didn't have to repeat second or third grade. Like, you're bright, you're smart, you can get this, but things were not in place in the school and at home to help with ADHD. So yeah, definitely prevention mindset is what we need for sure. It's
a great book. Once again, every parent and every teacher should pick it up. It's an easy, quick read. It's called ADHD Explained, what every parent needs to know. Dr. Hammond, before you got to go, give us your website, how people can get the book, and most importantly, how they can connect with you and the resources that you have available.
Yeah, definitely. So the book is available at viewbook.at/ADHD Explained. You can also reach out to me. The best way is on my website. It's drnekeshiahammond.com, which is DRNEKESHIA Hammond.com.
Dr. Hammond, thank you so much. Thank you for your commitment to really being the change that you want to see in families and in schools and in our communities. It's a great book, and one that every single person that is ever concerned about a child should pick up. Thank you so much for taking the time.
Thank you so much. It's been a pleasure.
Indeed. Hey, everybody, stay on point. We're back after this. Good morning, everybody, and welcome. I'm Carlette Christmas.
And I'm Glenda Stock, and this is our final point today on Point.
Glenda, let me just say this. It's always better when you're here.
Oh, thank you.
I miss you when you're gone.
I missed you too.
We've been busy, though.
You have been. And thank you for holding it up so well.
Indeed,
so well.
indeed. And maybe one of these days I'll get a chance to go on a vacation.
Oh, I think it's a given. I think it's a must.
It's coming soon.
Absolutely.
But before that, we really are always honored to have Dr. Nekeshia Hammond on the show. She is a great psychologist, but she is talking about a subject that a lot of parents have been overdiagnosed with their children in terms of ADHD. And she really breaks it down in a very simplistic form so that parents and hopefully even teachers can take a little bit harder and closer look at ADHD.
A subject that is definitely needs to bubble up and have more discussion. You know, I just spent a weekend with 4 of my little great nieces and nephews. And I will tell you, at least 2 of those have been on during their lifetime medication for ADHD. And I have an older nephew that was on medication as a younger child. You know, I think there's amazing value in getting the proper diagnosis. And what Dr. Hammond shared today, I think, is so insightful that we ignore the fact that there are so many other things that can be causing what we only see as the visual misbehavior.
Right.
You know, and that misbehavior or inattentiveness sometimes is easily diagnosed as ADHD, when in reality, as she pointed out, we may be dealing with a thyroid disorder,
right?
A low blood sugar disorder, a learning disability. And I think in my very own family, we've begun to unveil that
indeed, did y'all take a closer look?
Yeah. Well, I think it's presenting itself as these children get older, that sometimes just taking the ADHD medicine is not necessarily solving the learning disability that exists there. So a topic that I think needs more roundtable conversation, because we know that it became the period of time where it was the most overdiagnosed, illness among children.
And I think it still is.
And in our case, frankly, yes, most of those observations came from their teachers.
Yeah. And talk about that, because, I know when our son was in 3rd or 4th grade, we were presented with that as well. And we really started taking a hard look. But if your child is not doing well in school, grades are failing or poor, and your child's teacher says, I think your child has ADHD, you almost grab hold of that. Because you want your kid to do better in school.
Sure. Certainly our children cannot be floundering. There must be a reason.
It's got to be a reason
for this. And yet, as pointed out by Dr. Hammond, we assume that children are immune sometimes to the personal circumstances going on in their lives.
Right.
They're just children. They really don't know any different, and that is so not real.
Right.
And again, having gone through some very, very trying times, some of these children I'm talking about, with mothers with addictions, and thank God, saved and healed now, but some very troubling times for these children.
And nobody ever really took a look at that side of it.
We just assumed that because they were 1 and 2 years old that, they don't know any better, because we were showering them with love, so what else could possibly they need? Well, guess what? They're much, much smarter and much more aware of what's missing in their life from a natural given, like their mom and dad, So I just think that the topic cannot be discussed enough, and I'm just so pleased that Dr. Hammond has done the research she has done and put it in a language that parents and family members can understand and know that it doesn't mean that you're a bad parent
at all.
To have these children with these behavioral issues. Right. It means that you have, you have an illness on the table to deal with and to solve.
And one of the things that she said that I think is so important, and one of our great sponsors of the program, Journey Rehab, Life is a Journey, Let Us Walk With You, they are in a position to help families. And sometimes, Glenda, counseling is the last thing that we look at instead of the first thing.
Right.
You know, and she talked about that. Sometimes you have to have that piece in place to dissect what's going on. And I think that a lot of parents that maybe are feeling like the medicine is not working, or now you're starting to question, was my child misdiagnosed? And she said it, we love our pediatricians, but we spend a few minutes with the pediatrician and we say this, and this is going on, and they give you a prescription.
Here's the solution. Yeah.
Right.
Yeah.
And
we're as guilty of taking it that way.
Because we want to fix it. We are fixers.
Sure.
You know, by nature, especially women, we want to fix it. We want to make it better. We want to see our kids succeed and move along with, you know, the rest of the pack.
Right.
When it may be a place like Journey Rehab where you can get counseling, where you can get into the child's psyche. As you said, it could have been something, a hurt early on that we just passed by because they were too young to know.
Absolutely. And you know, it's I have spoken to a couple of adults in my lifetime that they are still on ADHD medication. And so I know that there is a valid place and that there is a valid diagnosis that exists among some people. And these folks have talked about, you know, how their life was a wreck and stayed a wreck. And they were not children diagnosed early. These were not diagnosed until they became young adults. And the difference, you know, that it has made in their life. But unfortunately, I think all too often, the quick diagnosis and the quick fix is what really has occurred that's created this landslide. And I don't know, the percentages were 5%. It feels to me, if you go into a little classroom of some of these children, you know, frankly, it's probably closer to 20% at least, you know, that you find falling into that category. So I love the fact that, again, she's willing to
challenge
talk with us and that it's okay to ask, are we sure? And has the blood work been done? You
and
know, as I sat there and listened to her, I'm not even sure in our household or our family that occurred.
But you can only know what you know.
Correct.
You didn't know. And most people don't know to ask for that. We just take it on its face. And so, but what the book does, Glenda, is and she said, you know what, I talk to parents all the time. They don't want to know the science. They want to know how to help their children.
They want to know how to make it better tomorrow.
And so if you pick up this book, it's a easy read. It's easy to understand, and it will give you some ideas about questions that you need to ask, about other areas to explore before you move straight toward medicine.
You know, again, we're very guilty of thinking that these physicians have this infinite wisdom and knowledge, and yes, they certainly have studied in fields that we have not. But sometimes, as a dear person in my life once said, we're always one question away from everything that we really need to know.
Oh, that's good.
And I think that's so true, is that we don't sometimes feel the authority to question those people, those professionals. But her message today is loud and clear. Speak up and speak out and ask that added question. It may be just what your child needs.
Very good. Hey, we're out of time for now. I'm Carlette Christmas.
And I'm Glenda Stock. And this has been our final point today on Point.
Stay with us, everybody. We're back to wrap up right after this.